I'm all ears.
Good morning. Thank you for your support for nurses and allied healthcare workers who've been denied a pay rise this year alongside other public sector workers despite being on the front line through the pandemic. We represent your local NHS campaign group, Hands Off Bedford Hospital. This is Jenny over here, who has been organising the group and campaigning for years. My name is Mary and I'm a nurse with 34 years NHS experience. So to start with, I'd like to read this poem and set the mood. This was actually found in a group called Poetry Lovers, and I don't know who the author is, but I think it reflects how nurses and healthcare workers are feeling. So it's called Fire. Remember what you must do when they undervalue you, when they think your softness is your weakness, when they treat your kindness like it is their advantage. You awaken every dragon, every wolf, every monster that sleeps inside you, and you remind them what hell looks like when it wears the skin of a gentle human. Well, we're in the middle of a pandemic and there's limits to what we can do, but we're here to voice our anger, and this is a national day of action. So why are we angry about not getting a pay rise this year? At least 540 healthcare workers have lost their lives during the COVID-19 pandemic so far. This is by far the highest healthcare worker death toll in Europe. COVID-19 has not gone away, and neither have we stopped giving care. But Boris Johnson has forgotten how grateful he was to the nurses who saved his life a few months ago. I want to say here, thank you for the clapping. It really did boost our morale during a difficult time. But it doesn't pay the bills, and we have put our own lives on the front line right through the pandemic, treating infected patients, whether we worked in hospitals, in the community, or in care and nursing homes. The government says we had a pay deal a couple of years ago, and so we've had our pay rise already. A few months ago, though, the government promised recognition to the healthcare workers following his coming out of hospital. But now they say we've had a pay rise. We did actually have a 3-year pay deal, but for many of us it was not a rise, particularly against the levels of inflation. This is the reality. The government has actually blurred the lines between professional progression through increments and between the actual pay rise that is across the board. Back in May, Matt Hancock said some nurses had had a rise of 15%. I struggled to find any nurses who felt they'd had that level of pay rise. I checked this out with Full Fact, an online fact checker, and this is what it says. It doesn't appear that any group of the lowest paid nurses would have seen their pay increase by this much over a single year as claimed. Salaries for most NHS staff are arranged in bands, and newly qualified nurses start out in band 5, which starts at £23,907 in England. The more years of experience nurses accumulate, the higher their pay gets at band level 5. Between 2019 and 2021, nurses in band 5 would have seen their salary increase by between 3% and 12% through a combination of the amount you could earn at band 5 being increased and their own progression through the pay bands after gaining another year of experience. So it doesn't appear that any group of lower paid nurses saw a salary increase of 15% over a year. Also, money is only as valuable as what it can buy you. So when comparing pay over time, it's most useful to adjust these figures to account for inflation, allowing you to calculate what's called a real terms change. Looking over the past decade and adjusting for inflation, there have been real term increases in nursing pay in recent years, but these haven't counterbalanced real term decreases which happened over the early and mid-2010s. This holds true regardless of which measure of nurse pay you look at. One measure is the average pay of all nurses, regardless of band. The average basic pay for a full-time equivalent nurse or health visitor increased by 2% between the year to June 2018, when it was at its lowest real terms level over the last decade, and the year to December 2019. But since the year ending August 2010, when the NHS started publishing these statistics, average nurse pay, taking all bands into account, has fallen by 7.4% in real terms. Furthermore, over the past decade, the average Band 5 NHS nurse is now £6,144 per year worse off due to wages failing to keep up with the rate of inflation. A real terms pay cut of around 20%. That's from Full Fact Org. It is perhaps hardly surprising that there's a recruitment crisis, not helped by nurses now having to pay for their training as nursing bursaries have been cut, and that we've had a shortfall before the pandemic of 40,000 nurses in the UK. Nurses also have to pay to stay on the register every year, and most nurses have to pay quite substantial parking fees at the places that they work at. Nurses also rely on the rest of the healthcare team to keep things going. We would be nowhere in this pandemic without our cleaners, porters, physiotherapists and healthcare assistants. And every single one of them has also worked through this, risking their lives, and deserves a pay award too. Not to mention those in care and nursing homes who are placed directly in the front line without PPE in many cases, a national scandal. You may recall the row over doctors' contracts and pay in 2017, which ended in junior doctors being forced to take a contract which would leave them worse off and with less safe working conditions. So we also have a shortage of doctors too. But there's more going on than just pay. I also want to talk about creeping privatisation, the taking away of your NHS services. This has been happening for a while, but it's increasing under the cover of this pandemic, and we need to make a fuss. In 2016, NHS England began the work of splitting NHS provision into 44 organisations. These were originally called accountable care organisations. When NHS campaigns alerted the public, because accountable care organisations are how care is organised in the US, the name was swiftly changed. But the project still went ahead and is now known as integrated care organisations. There is nothing accountable about these organisations, and there's also little integrated, except the paring down and merging of management structures. You see, it's all about reduction in order to make profits, now that private companies and their shareholders have a big part in the NHS. In October 2019, it was estimated that 25% of NHS spending now goes on the private sector. We have companies like Virgin using our NHS logo. In fact, the NHS is becoming just a logo. If you are afraid of an American trade deal, American healthcare is already here. In 2018, you may be aware that NHS England axed 17 surgical procedures from the NHS that they decided are unnecessary. However, they are still available if you pay for them. These procedures are not unnecessary, or they wouldn't be available at all. I can personally vouch as a nurse for some patients they're not only beneficial, but absolutely necessary in order for them to be able to live lives without pain or debilitating conditions. As of last year, there are also 35 prescription items that are no longer available. You may say these things are available over the counter. You may say some of the things are cheap, like paracetamol, to buy. But if you have to choose pain relief, or heating your home, or feeding your child, and you literally do not have any money, and we see the evidence of poverty all over the UK, then it's not so easy to dismiss. The NHS was set up for those people, the people who couldn't access healthcare, so that it was available to all. Where will this stop? The most common reason people go bankrupt and lose their homes in the US is medical bills. Your NHS is being dismantled and you need to do something. NHS England is not the NHS. NHS England was set up to dismantle the NHS. It is headed by Simon Stevens, a man whose background is American healthcare. And now we are having trade talks with America. Perhaps some of you remember Donald Trump letting slip that the NHS is on the table in trade deals. He wasn't supposed to tell you that, and the government denied it. But I'm afraid this is the plan. Trump has continued to insist this, and Donald and America usually get their way, at least as far as our government goes. As I said, American healthcare is already here, and if we don't recognise this and fight, it will continue. During the pandemic, we've had to devise different ways to see our patients, so video consultation has been used a lot more. This has been sensible to reduce the spread of the pandemic. But now Matt Hancock is proposing that we don't ever go back to face-to-face appointments with our GPs. This is disastrous. There are many cues you pick up from face-to-face that you do not over the phone. This puts patients at risk, and video consultation has its place, but it cannot replace face-to-face appointments, and many people are struggling to use the technology. It has been a challenge for us during this pandemic to help them using the technology, and there are many who do not have access to it. Locally, we have fought cuts to our A&E, paediatric and maternity services over the years successfully, but for how long? As these services are being cut across the country. We have successfully fought for our walk-in centre, but we've seen its hours cut. We've lost services like stroke services, and now our hydrotherapy pool. Preventive services have been eroded, and charges have been introduced, first for migrants, and who's next? The NHS was set up to be universal, free at the point of use, for all of us, to take care of us from the time we were born to the time we depart this life. But where will our children have the security? Will our grandchildren? Will we in our old age? Why am I talking about all this? Well, it's not just pay that's causing the largest exodus of nurses in history. It's the conditions too. We don't want to work in a service that's unsafe for you. We want to give good care. We come into the service because we want to treat all our patients, regardless of their ability to pay or not. Nursing is in fact a privilege. I love my job, but I don't like the things that hamper me doing my job and the hoops patients now have to jump through to get to the care they need. Nursing is a privilege, but it's not a vocation. Nurses have families and bills to pay. It's a scandal that our lowest paid healthcare workers in some of the most responsible jobs are having to use food banks while risking their lives. Pay is of course a big factor in attracting people into the profession, but it's so much more. So what are we to do about this? The NHS will last as long as there are folk left with faith to fight for it, said Nightman. And we need to fight this. We need the support of the public in any protest. Join the protests when they happen, and they will happen. We need the public to write to MPs, write to your papers, write to the CCG, join campaign groups, share the campaigns on social media, sign petitions, but above all, start making a noise about this. If you are in a political party, lobby your party. Demand the NHS is put back into full ownership, restored and properly funded. Get this talked about everywhere. I have a poem of my own to share in conclusion. It's called Cradle to Grave, and I wrote this in 2017. God bless the nurses and doctors too. We really don't know how you do what you do. From the giving of pills to the lives that you save, the NHS there from the cradle to grave. Ambulance queues outside stacking, the nurse's voice cracking. Again, there's no beds, they're in over their heads. God bless the nurses and doctors too. We really don't know how you do what you do. From bandaging wounds to the lives that you save, the NHS there from the cradle to grave. The lists are all growing, while no respite is showing. There isn't the money, but Hunt finds it funny. The doctor's contract? He'd rather change that than fund our health care. He's stripping it bare. God bless the nurses and doctors too. We really don't know how you do what you do. From tending the dying to the lives that you save. The NHS there from the cradle to grave. We thank you for this, but we'd rather fund war. We'd like to reward you, but our money's offshore. We praise you most strongly for the work you have done. We would now like healthcare run by Richard Branson. Where are the nurses and doctors too? We really don't know what has happened to you. We thought the purpose was life to save. The NHS gone from the cradle to grave.